So let's begin with Ben Bradshaw, who is a Labour Member of Parliament, himself a former health minister, but also a former culture aficionado as well. I hadn't warned you of this because I saw it and couldn't not ask you about it. You can say pass or answer it. But Jeff Boycott choosing his birthday celebrations to say that in his case the BBC swapped quality for equality, says Jeff Boycott. Has wokery got a bit out of control at the BBC in your view, Ben?
Sorry, has what, Alastair? I didn't catch that.
Wokery, I decided to call it.
Oh, right. No, I don't think so. Look, the BBC is a well-established public service broadcaster. It has to appeal to all tastes, and not all of us love everything that's on the BBC. But I still think for the price of about a pint of beer a week, given the range of its programming, it offers very good value. And also, I think, at a time when there's increasing concern about fake news and the reliability of some of the information that's available online, having trusted broadcasters that are regulated in the same way as you are, talkRADIO, all broadcasters here are regulated to some extent, is really valuable in the world that we live in.
Okay, I wanted to get that on the record, and interesting thoughts there on that as well. Let's talk about COVID then, Ben. The last time that you and I talked about this, you were, and I use the word advisedly, you were angry about the slow progress in getting a good test, track and trace system operating. The two scientists I spoke to in the first hour of this programme said that remains the biggest scandal on the map.
Yes, I completely agree. And it's not only not working, it's got worse from when we last spoke. The government boasts repeatedly about how many tests it's conducting. It's true, we're conducting quite a lot of tests in the United Kingdom, but the real problem is in the tracing. And if you don't trace people, and if you don't trace them quickly, it's all pointless. And that's why we've lost control of this virus. And what politicians all over the country, whether Labour or Conservative, have been arguing now for months, is that the government should give local public health officials and local authorities control of this process, because they have a far higher success rate in tracing contacts, 97% in some cases, than the national privatised Serco-run system, which at best is around 60%. And 60% is simply not high enough if we're going to control the virus, and that's why we're in the mess we're in.
Do you think, in addition to that, that it is conceivable that we've got to a point now where, if you look at the data, testing, even given those shortfalls that you've described there, is much bigger in volume terms than it was back in the worrying spring, but infections are not as high and the death rate is not as high, that is it possible that we are approaching a period now where we can begin to calm a little and relax a little?
No, I don't think so. I mean, you're right on the death rates, although we saw the highest number of deaths, didn't we, yesterday than we've seen since, I think, June. But the infection rate is very high. And let's hope that doesn't necessarily mean that we'll have such a high mortality rate. Treatments have improved, that's true. Hospitals have a better idea now about how to treat patients. But if you look at what's happening in other countries and what's happening in some parts of our country now, in Liverpool, the hospitalisation rate's very high, and this virus is still here, and it's still as lethal as it ever was. And that is why we believe, Labour believes, that there should not only be clear national criteria for those areas that are being forced to go into Tier 3 by the government. The problem at the moment is we have different rules in different places, sure, different levels of financial support, no incentive really for people to stick by those rules if they're losing their jobs and livelihoods. And we've also called for a temporary circuit breaker to allow us to reset, get to grips with this, bring the numbers down, and get on top of the testing and tracing system. Because we can't live with this virus, save lives and keep the economy going if we don't have a functioning test and trace system.
You mentioned international comparisons, and two absolutely striking. I mean, Spain makes us look like a fantastic success story as things stand right now, whereas Sweden, which you know perfectly well, so many people say, look, why didn't we take the same approach as Sweden? We do the right thing on personal hygiene and distancing, but this shutdown, lockdown stuff simply doesn't work. And Sweden appears, at the moment, to be doing better than most other European countries.
Yes, it's very interesting, Alastair. A lot of people look at Sweden, but I heard their chief epidemiologist say yesterday, what we basically have in Sweden is a voluntary lockdown. What people have to realise is in Sweden, if you go into lockdown, you lose your job, you stay at home because you're shielding, you get 80% sick pay. In this country, it's, 90 quid a week? That's the difference. If you want people to stick to the rules, go into lockdown, stay at home, leave their work, lose their incomes, for public health reasons, you have to support them. Now, this government did that, or for most people, not for all people, but for most people at the beginning of this pandemic. They're not doing so now, and that's part of the problem. That's part of this battle that you're seeing between local leaders who know what's going on in their patches and central government.
Is that, in your understanding, and you know these people intimately, and you worked alongside Andy Burnham in government, was that essentially the sticking point in Manchester? That amount of money that was made available for folk who are going to lose their jobs. It wasn't about how much money you need to track and trace and run the rest of it. It was about folk losing their jobs.
Yes, and don't forget that Manchester has been under some sort of restrictions now for 2 months, and they haven't worked. And I think that's the problem that we have with what the government's doing. It seems to be the worst of both worlds. Its strategy is not bringing the virus down. It's growing everywhere. Every region of this country is now above R1 on the R rate, which means it's spreading out of control. But at the same time, the financial support isn't in place to allow people to do what we all want them to do, which is to do the right thing if they're infected or if they're a contact that's been traced.
But Andy Burnham did get a lot of criticism for saying, it isn't, as you've just said yourself, we don't have this problem, we don't need this kind of restriction, it's simply wrong for us, but if you give us a lot of money, we'll accept it.
That's not quite his position. I mean, he said quite clearly he thinks we should have a temporary national circuit breaker, but in the absence of that, we need clear criteria for when a region or an area goes into tier 3 and the level of support that it receives. We've never had that. And in fact, some of the parts of the country like my own, which have relatively low rates now, our rates are now higher than they were in some of those northern cities when restrictions were imposed 2 or 3 months ago. So there's no consistency in the government's approach. And I think that's why we've got this chaos and confusion. And that's the very worst thing you want when you're trying to deal with a serious national pandemic like this.
You've got a great university in your constituency as well. One of my nephews went to it. Is that boost in the numbers, as has certainly been argued about Manchester and Liverpool, a result of the young men and women coming back to their studies at Exeter, Ben?
Yes, Exeter's been a very interesting microcosm of the impact of students coming back. We had quite a big spike, which actually put us, on paper at least, in the top 10% of the worst affected places in the country temporarily, but that's because we're a small city with a big student population and we had a little outbreak in student halls. The university has done an incredible job at controlling that and bringing those numbers down, and they now are coming down. But the way the university did this was by introducing its own test and tracing system, privately paid for, privately funded. It turned around the results in 12 to 24 hours, which meant it could identify the people, close them down, shut them down in their houses, and that's got to grips with the problem. That's what we're lacking in the national privatised Serco-run system. OK, which leads me to my penultimate question, which is your reaction to Jonathan Van Tam, Professor Jonathan Van Tam, the Deputy Chief Science Officer at the Prime Minister's press conference yesterday, who took Sir Keir Starmer and Labour's policy head on and said a national lockdown, circuit breaker, as you just called it, is not the right answer. He is an independent scientist, albeit in Her Majesty's government's employ. If he says that, Labour is wrong. Well, I didn't see what he said, and I didn't see the context in which he said it. All we do know is that the published SAGE minutes of the meeting 1 month ago now did recommend a national circuit breaker as the most effective way of getting on top of this virus, to give us a chance to reset and get the testing system right. It may be that Jonathan Van Tam said what he did yesterday because he now believes that's too late. The government has left it too late. The virus is now out of control and we just have to muddle through. I think that would be an absolute disaster, and it would be Boris Johnson's responsibility if that's where we head.
Why would muddle through be a disaster? You've known me long enough to know, I hope, that I'm not an idiot. But if you read the Danny Finkelstein piece in the Times this morning, which I know listeners will get cross because I've mentioned it so many times now, but it's a standout piece. Yeah, cracking it via lockdown, cracking it through isolation and all the rest of it doesn't look that watertight, it may be that we've got to learn to live with it.
Well, we do have to learn to live with it, but you can only live with it if you have an effective testing and tracing system and adequate financial support for those individuals you're asking to give up their livelihoods. It's not rocket science here. There are countries that are doing better than us. Germany is the prime example. Italy's done very well until the last few weeks. They have locally and publicly run test and trace systems. That's what we need here. It's what we've been calling for months. The government has said it agrees with us now, but it's still not giving local authorities the powers, the data they need, and the resources to do the tracing. Where it's happening, they're controlling the epidemic. Where it's not, we're not.
Final question. Do you wish Andy Burnham was back in the parliamentary bit of the party and back in leadership?
No, I mean, I think Andy Burnham's doing a great job. Speaking on behalf of Manchester, he has support across the political spectrum and from the business community and from the public. And actually, what we're seeing is something very interesting, which is the regions of our country finding a voice. And I hope that one of the things that comes out of this will be a recognition in all parties, including in this governing party, that one of the reasons Britain has done so badly on coronavirus is we are far too centralised as a country. Most other countries that have decentralised systems, where you have local or regional leaders in control, have done far better. And, you know, one of my criticisms all along, and I think we spoke about this before, Alastair, is the government's over-centralised approach to this whole virus. It can't continue like this. It has to learn to work with local and regional and national leaders in Scotland, Wales and Northern Ireland. Otherwise, I don't know what's going to happen, to be honest.
But you don't get much more centralised and national than having a Labour Party lockdown across the whole country, Ben.
Well, that's in order for us to reset. I mean, what would happen after that is you could go back to a regional or a local approach. But the approach the government's pursuing at the moment simply isn't working. It's the worst of both worlds.
Ben Bradshaw, thank you for joining us. Good to talk to you. Ben Bradshaw, Labour MP for Exeter there, former Health Minister and former Culture Secretary as well.